All right, let's jump right in. Today we're tackling pediatric respiratory care.
Ooh, yeah.
And, you know, we love to go deep.
Absolutely.
So get ready for a fascinating deep dive.
Yeah.
We've got some great notes here
Yeah.
and a chapter from a medical textbook.
Uh-huh.
And we're going to extract the most important insights just for you.
All right.
No need to wade through all that technical jargon.
No.
We'll make it clear,
Yeah.
engaging,
Mm-hmm.
and, even a little bit fun.
Yes.
So basically, we're going to learn how healthcare pros examine
Uh-huh.
and assess children who might have respiratory issues.
Okay.
And what I find so fascinating about this
Yeah.
is that it's like detective work.
Yeah, it is.
You have to piece together these clues from the child's history, from their physical signs,
Yeah.
and even, get this, from non-pulmonary findings.
Really?
That's what I love.
It's really interesting because
Yeah.
you think about breathing, you think about the lungs,
Right.
and that's it.
Yeah,
But it can be so much more than that.
exactly.
It can be multi-system.
Yeah, so it's like a holistic approach.
It is. It is.
Okay, so let's imagine a child comes in with, I don't know, let's just say breathing difficulties. Where do they even start?
Well,
The healthcare providers, where do they begin?
the first thing is always that chief complaint, right?
Yeah.
That's like the headline.
Yeah.
Why is this child here?
Right.
That's the launching point. That's how we start the whole investigation.
So it's not just about, oh, they're coughing.
Right.
It's about understanding,
Yeah.
okay, what's the context of that cough?
Exactly. And then we go into a deep dive
Okay.
of their medical history.
Right.
Have they been sick before?
Uh-huh.
Do they have any, family history of breathing problems,
Yeah.
allergies, things like that?
Okay.
Even things like, do they live with a smoker?
Really?
Yeah. Have they been exposed to mold?
Wait, mold can affect breathing.
Absolutely.
Wow.
Environmental factors play a huge role,
I guess I never really thought about that.
Yeah, because especially for kids,
Yeah.
their lungs are still developing, so they're much more sensitive
Oh, that makes sense.
to any irritants in the air.
Wow.
And even stress, believe it or not.
So you're saying a kid's anxiety could be a sign of a respiratory problem?
It's not always the case,
Right.
but it can be a clue.
Interesting.
The textbook even mentioned that fussiness,
Yeah.
anxiety in kids can be a sign of respiratory distress.
Really?
Yeah, it's all about connecting the dots.
Wow, that's amazing. So doctors have to be like part Sherlock Holmes, part child whisperer.
Yeah, you could say that.
That's fascinating.
It's a very specialized skill set for sure.
Yeah.
Once they kind of have a good grasp of the background,
Uh-huh.
then they move on to the physical exam.
Okay, so this is where the stethoscope comes in, right?
Well, that's part of it.
Oh, okay.
But it's so much more than that.
Really?
It's not just listening to the lungs. There's this whole routine.
Okay.
It's inspection, palpation, percussion, and then auscultation.
Okay, now I remember as a kid,
Uh-huh.
doctors would always like tap on my chest.
Right.
Is that the percussion part?
That's it.
Okay.
It might seem a little old school, but
Yeah.
it's really useful
Okay.
because by listening to the sounds produced when you tap on the chest,
Mm-hmm.
doctors can actually tell
Wow.
if there's fluid buildup,
Oh, wow.
air trapping.
Oh,
They can even estimate the size of a lung problem.
really? Just from tapping?
Yeah, it's like
Incredible.
sonar for the lungs.
Wow.
That's a great analogy.
That's a good one.
And, it's a technique that still holds up,
Wow.
even with all the fancy imaging technology.
That's amazing.
Yeah,
Okay, so percussion is all about the sounds.
right.
What about those other parts of the exam?
So inspection is all about observation. The doctor's looking at the child's breathing rate,
Oh,
their skin color,
mm.
how much effort it takes to breathe.
Uh-huh.
Even their posture
Wow.
can be a clue.
I never would have thought about posture being relevant to breathing.
Oh, it absolutely can be.
Wow.
Like, are they hunched over?
Mm-hmm.
Are they using their neck muscles to help them breathe?
Interesting.
Yeah. These are all signs of respiratory distress.
So it's like a visual puzzle they're trying to solve.
Exactly.
Yeah.
Then there's palpation,
Yeah.
which is all about feeling.
Okay.
The doctor will use their hands
Ah.
to check for tenderness,
Okay.
unusual vibrations in the chest,
Mm.
and make sure that the trachea,
Okay.
which is the windpipe,
Right.
is in the right position.
So they're gathering evidence with their hands, too.
Precisely.
Wow.
Building a complete picture
Yeah.
of what's going on inside
Uh-huh.
the chest.
And then finally, we get to auscultation.
Right.
The classic listening with the stethoscope. The moment of truth.
Yeah, here the doctor's listening for any abnormal breath sounds,
Oh, okay.
like wheezing, crackling,
Yeah.
or stridor.
What's stridor?
It's a high-pitched sound
Oh.
that can indicate a blocked airway.
Oh, okay. So all 4 parts of the physical exam,
Mm-hmm.
from looking to listening,
Yeah.
are about gathering clues.
Exactly.
It's fascinating.
And here's the thing.
With that.
It's not just about the respiratory system.
Oh, what do you mean?
So a comprehensive exam also includes checking the child's growth, examining their heart,
The heart.
even looking at their skin.
Hold on. Why the heart?
Okay, so
I thought we were focusing on breathing.
this is where it gets really interesting.
Okay.
In kids,
Yeah.
cardiac and respiratory problems
yeah,
are
thank
often
you.
intertwined.
Oh, that makes sense.
Yeah.
So, like, if the heart's not pumping efficiently,
Exactly.
it could affect how well the lungs work.
It can. And the reverse is true, too.
Interesting.
Chronic respiratory problems can strain the heart.
So they're really interconnected
They are.
in ways we don't always consider.
Right.
So you need a really thorough exam to know,
Right.
okay, is this in the lungs? Is this the heart?
Yeah.
Or is this something else entirely?
Exactly.
It's like a medical mystery.
It
as they
is.
say.
And speaking of mysteries,
Okay.
once the doctor has all this information from the history, the physical exam,
Yeah.
they might decide to order some lab tests.
Oh, so that's the next layer of the investigation.
It is.
I'm curious to learn more about these tests
Yeah.
and what they can tell us.
Absolutely.
Okay, lab tests. I gotta say, this is the part that always makes me a little nervous,
Yeah.
but I guess they're necessary, right?
They are.
To get the full picture.
Absolutely. And the good news is
What's that?
doctors always start with the least invasive options,
Oh, okay.
especially with kids, right?
Makes sense.
Minimize discomfort and anxiety.
Yeah, for sure. So what kind of tests are we talking about?
So a common starting point
Right.
is pulse oximetry.
Pulse oximetry.
Yeah, remember that little clip they put on your fingertip?
Oh, yeah.
That's it.
Okay.
Measures the oxygen saturation in the blood,
Mhm.
gives you a quick snapshot of how well the lungs are delivering oxygen.
So that's how they know if you need extra oxygen or not.
Exactly.
Okay. Pretty straightforward, but essential.
It is.
Says- What else?
Next up, we've got the classic chest x-ray.
Oh, yeah, the chest x-ray.
Like getting a sneak peek inside the chest. You
Yeah.
can see the lungs, the heart, the surrounding structures.
I can imagine that's helpful for spotting things like, I don't know, pneumonia
Mhm.
or a collapsed lung.
Right.
But what if the x-ray doesn't give them all the answers?
Then we've got to dig a little deeper.
Okay.
Blood tests
Uh-huh.
can reveal a lot about what's going on.
Okay.
They can check for infections,
Uh-huh.
inflammation,
Mm-hmm.
even look for signs of allergies
Oh, interesting.
that might be contributing to the breathing problems.
Okay, so it's like we're adding more layers to our detective work.
Exactly.
Each test gives us more information.
It does.
But what about actually measuring how well the lungs are working?
That's where pulmonary function tests come in.
PFTs?
PFTs, yeah, they're a bit more involved,
Right.
but they give you so much information about lung capacity,
Okay.
airflow,
Mm-hmm.
overall function.
I've heard of those, but they sound kind of intimidating.
Yeah.
What exactly do they involve?
Well, it depends on the age of the child,
Okay.
but for older kids, it often involves breathing into a tube
Okay.
that's connected to a machine.
Uh-huh.
The machine measures things like how much air you can inhale and exhale,
Okay.
how quickly you can blow air out.
So that explains the function part?
Yes,
But what do those measurements actually tell us?
they can reveal a lot.
Okay.
For instance, there's a measurement called FEV1,
FEV1.
forced expiratory volume in 1 second. It basically tells you how much air someone can force out in a single breath.
Okay.
If that number is low, it could suggest airway obstruction,
Oh,
which is a common sign of asthma.
so those numbers can be really important
They can.
for diagnosis.
Absolutely.
You mentioned earlier that sometimes lab tests could point to problems
Yeah.
outside the respiratory system.
It can?
Can you give me an example of that?
Absolutely. Imagine a child with recurrent wheezing.
Okay.
They've done the x-ray,
Uh.
checked for infections, but nothing seems to explain it.
Okay.
Then they do a blood test, and bam.
Yeah.
It turns out they have a peanut allergy.
Wow.
So the wheezing wasn't a primary lung issue at all.
Right.
It was a reaction triggered by something they ate.
So the culprit was hiding in plain sight.
Exactly.
That's amazing.
It highlights how important it is to think outside the box,
Yeah.
especially when dealing with complex cases.
So lab tests really help us unveil those hidden connections. This is really making me appreciate the detective work
Yeah,
involved in pediatric respiratory care.
it is. It is.
But I am curious,
Yeah.
what happens after the lab tests?
Okay.
Do they lead straight to a diagnosis?
Well, not always.
Yeah.
Lab tests are just one piece of the puzzle, remember.
Right, right.
The doctor has to consider all the information,
Yeah.
the history, the physical exam findings,
Yeah.
and the lab results to
Huh.
get the clearest picture.
So it's like putting all the clues together and finally cracking the case.
Exactly.
But that's where experience and expertise really come in.
He does.
Well-
The doctor uses their knowledge
Yeah.
and judgment to interpret the results,
Uh-huh.
make connections, determine the most likely diagnosis.
It sounds like a pretty intricate process.
It is.
And sometimes it might even involve consulting with specialists.
Right. Yeah, you might need to bring in a cardiologist
Oh, okay.
or an allergist.
To get a more complete view. So even after all this, the investigation might not be over.
It might not.
Wow, it really emphasizes how interconnected different areas of medicine can be.
Yeah.
Especially with kids.
Especially with kids, that's right.
And this interconnectedness, I imagine, is even more important when we start talking about
Yeah.
potential complications
Right.
and long-term implications of these respiratory issues.
Absolutely.
That's where things get really fascinating
Yeah,
and where understanding the bigger picture becomes essential.
it does.
So we've talked about the initial assessment, the physical exam, and those really insightful lab tests.
Yeah.
What happens next?
Well,
Where does all this information lead us?
you know, this is where things get really interesting.
Okay.
It's not just about treating the immediate symptoms. It's
yeah.
about looking ahead, you
Right.
know,
Okay.
anticipating potential complications and considering the long-term implications.
So it's not just putting out the fire. It's about
Yeah.
preventing future fires.
Yeah.
I like that. For example,
Yeah.
recurrent respiratory infections in early childhood
Uh-huh.
can sometimes increase the risk
Okay.
of developing chronic lung conditions later in life.
Hadn't really thought about that.
Yeah, it's important to think about those long-term consequences.
So early intervention is really important.
It is.
Not just for the child's immediate well-being,
Right.
but for their long-term health.
Absolutely.
And I imagine this long-term perspective is even more crucial
Yeah.
when you're dealing with something like asthma.
Oh, definitely.
Because asthma is not something that just disappears.
Right.
It needs ongoing management, attention.
Right. It's about helping children and their families
Yeah.
develop coping mechanisms, understand their triggers,
Okay.
learn how to manage their condition effectively.
So it's not just about treating the disease.
No.
It's about empowering these children and their families
Exactly.
to live normal lives.
Yes, to live full and active lives
Yeah.
despite their challenges. So it's like, going back to our detective analogy,
Yeah.
it's like we've gathered all the clues.
Right.
We solved the case,
Mm-hmm.
and now we're helping them
Yes.
write the next chapter.
I love that analogy.
It's about fostering a sense of control
Yes.
rather than
Absolute.
fear and limitation.
That's a great way to put it.
And this next chapter, I imagine,
Yeah.
often involves a multidisciplinary approach.
It does.
Right? You've got healthcare providers, educators,
Yeah.
maybe even social workers,
Sometimes.
all working together
Absolutely.
to support that child and their family.
It really does take a village, you know?
It really does.
Especially when these issues have the potential to impact their development,
Yeah.
their well-being in so many ways.
So open communication,
Yes.
trust, collaboration.
It's essential.
This has been an amazing deep dive.
It has.
I feel like we've learned so much
Yeah.
about the world of pediatric respiratory care.
Yep.
You know, we explored those subtle clues
Right.
hidden in a child's behavior, the power of lab tests
Yeah.
to uncover those connections, and the importance of thinking long term.
It's been a pleasure sharing this journey with you.
Likewise,
I hope our listeners feel empowered
I think they do.
to learn more about this field.
It's so complex.
It is complex.
It's so fascinating.
And it demands not just medical expertise, but
Right.
empathy,
Yeah.
compassion, and a genuine commitment to these kids.
So as we wrap up today,
Okay.
what's one key takeaway you'd like to leave our listeners with?
You know, if I had to choose one,
Yeah.
it would be this. Never underestimate the power of observation
Okay.
and communication.
Interesting.
As parents, caregivers, even just concerned friends or family members,
Yeah.
we have a unique opportunity
Okay.
to notice those subtle changes in
Mhm.
a child's behavior, their breathing patterns.
And we should speak up
And
if something seems
it's
off.
Ask questions, Seek guidance.
Don't hesitate.
And don't hesitate.
That's such valuable advice.
Yeah.
It reminds us that we all have a role to play
We do.
in a child's well-being.
Precisely.
This has been a truly enlightening deep dive.
It has.
Thank you so much for joining us today.
It was my pleasure.
And to our listeners, thank you for tuning in.
Yes, thank you.
We hope you found this episode helpful and insightful.
We do.
And remember, knowledge is power.
It is.
The more we understand about pediatric respiratory care, the better we can support the children in our lives.
Absolutely.
Until next time,
Yeah.
stay curious
Stay engaged.
and keep learning.